Hello everyone, this is Charles Clinton from the Heart of Medicine, and I am currently a PGY3 in internal medicine. For the date, we have it's Friday 15th of November 2024, and actually Jake Paul will be fighting, right now probably, Jake Paul versus Mike Tyson. I just finished my rotation in infectious disease, and I just wanted to share with you how to determine and how to recognize a good rotation. So I will talk about my infectious disease pearls on my next video, but this one right here will be how will you determine as a medical student, as a resident, or as a fellow, what is a great rotation. So first of all, you don't have to have any expectation when you're going into this rotation. Like example, for me, infectious disease, I already did 3 months of it in my prior residency experience in Costa Rica. I also had a lot of exposure in medical school in Costa Rica. I came to this rotation like, okay, I'm just here to fill the box. I'm not going to be an infectious disease doctor. I didn't have high hopes, but guess what? I start the rotation and day number 1, I'm with Dr. Abramowski. And I didn't know much about him. I did know that he will test you. I did know that, but I didn't know anything else. And I just go to the rotation, and on the first patient, I see that he becomes interested. Firstly, he gives me an introduction into what we will be doing. Most rotations nowadays, you just get to the rotation and it's just like, if you're a resident, it's like, go see these patients and come and tell me about them. Or if you're a medical student, you aren't even introduced to the team. Sometimes you just get to a rotation and you have to ask like, nice to meet you. I'm such and such. Are you the upper level? And sometimes that happens. Well, Dr. A told me, okay, welcome to infectious disease. This is what you will be seeing. This is how it works. We are on call these days, and this is the usual schedule. And then he asked me, tell me a little bit about yourself. And he's like, what are your interests? And I told him, well, I'm interested into cardiovascular disease mainly, but I want to learn everything I can learn here. And also, of course, and he asked me, what do you want to learn here? What are your objectives? And he's like, I guess cardiology. And I'm like, not necessarily. I want to learn everything, of course, including cardiology, but I also want to focus on anything that might be on my board exams for infectious disease. So yeah, I want to learn everything. And he's like, okay, perfect. Okay. So he gave me this first patient, and he's like, okay, this patient I chose for you. See this patient? I saw the patient with endocarditis, and we go, when we're rounding, he lets me present the patient. He's not interrupting. He's listening through the whole thing. He already knows about the patient. He already has his own plan in his head, but he's not saying it. When I finish, he's like, okay, and yeah, your assessment and plan, and I give him my assessment and plan, and then he's like, okay, I'll ask you about a little bit about this. And he asked me some things about the question, about the patient, which are relevant. And I'm like, okay, this. And he also asked me, okay, let's talk a little bit about endocarditis. And yeah, so he asked me one question. I'm able to answer it. And he's like, okay. And let me ask you this. He asked me a second question. I'm able to answer it. And I can see that there's a little bit of joy in his eyes when I answer maybe 3 or 4 questions. And he's like, okay. And he literally does something like, so let me ask you this. And he asks you another question. Like he actually is joyful for you being able to answer questions and showing him that you are putting in the work. And he will take you into deep water to see where is your weakness, and will actually plant the seed right there so you grow, and that flourishes into a strength of yours. So that can even be quotable, right? If you want, you can pause the video and put that in the comment section. I think I just said something quote worthy, maybe, right? Not sure. Maybe I think too much of myself, right? Well, we all are narcissistic to a certain extent, so that's a real thing, and I'm also joking. Okay, so getting back to the topic, that's what I love. That's how you basically recognize a good rotation. A good rotation isn't the easy peasy rotation. Yeah, those are also good, to be honest, when they are like, okay, go home, and it's like midday, and you're like, for real? Yeah, I can leave? There's sun outside. This is great. And they're like, yeah, you can, okay, woo, and you leave, right? Those are also great rotations, and whenever that is possible, yeah, you have to appreciate it, because, of course, work-life balance, sometimes it's highly appreciated. But of course, you also have to appreciate when you're taken out of your comfort zone. That's what I'm trying to get to. People who try to actively seek to plant the seed and seek to help you out, not for right now, but for the future, right? Because he asked me, okay, what are your interests? So he helped me out throughout the entire rotation, actively being conscious about it and thinking, like he was thinking through everything I was saying. And I even felt I had the opportunity to walk him through my own reasoning. So sometimes I didn't have an answer for something, and he would ask me a question, and he would be like, hey, Charles, I will ask you this. I know this. You probably might not know the answer for this, but I'll ask you about this to see what you think. And he would ask me a pretty specific infectious disease question, and I would be like, okay, so my reasoning would be this and that, and I would walk him through it. And I would say like, okay, I would not do this. I would exclude this, and this, but I would think it could potentially be this. And he's listening to you, right? Listening, and he's like, okay. And if I got to the answer, he's like, okay, yeah, I agree with that. That's great. If I didn't get to the answer, he's like, okay, now you're missing this little detail. If I tell you about this, would this change what you're thinking? And he would be there listening. And this is incredibly important for a good rotation and for actual growth. Because whenever you're taken by the hand and you're just taken by the hand and you're trying to present your patient and you haven't gotten to the assessment and the attendant immediately cuts you off and tells you, okay, we'll do this and this and let's go to the other patient, you will learn 15% or less than what you will actually learn if you're taken, if you have to present your patient and you're given the chance to give your assessment plan, and not only that, you're tested on it. So then you're asked, okay, you chose such antibiotics over such other antibiotic. Is there any reason you made that decision? And that's cool because it shows that the attendant or that person who is above you in the hierarchy system, which is supposed to be thinking about how to help you grow, is actually letting you speak, seeing what's your reasoning and how they can actually help you. Wherever you will grow is where they let you speak, because that's how they will understand where you have to grow. Because of course we cannot communicate telepathically yet. So that's the rotation you want to be in. You want to feel uncomfortable, like straight up, right? You want to feel sometimes even bad. I know everyone has imposter syndrome to a certain degree. I have it as well. And at times when I don't have the answer, I feel bad. But I've been in medicine for enough time already, and now this is my second residency experience, that I take everything constructively. Like everything, someone might say, you want to do this, you want to do that. I'm like, what is the clinical pearl I can take out from here? How can I improve on this? Okay, so that's what you should do. So whenever you don't have an answer, yeah, feel bad, but when you learn it, you'll feel way better, right? So I do feel bad. I feel horrible whenever I'm asked a question about my patient and I have no answer. But I feel bad, but I know it's part of my learning experience. I feel pissed off, to be honest. I'm like pissed off with myself. You should know this. You should remember this. But guess what? Sometimes I'm asked something and I don't know it, and I'm like, and they're like, do you have an answer? And I will straight up say, if I don't know, I'll be like, I'm not sure, but can I guess? Can I do a like guided or smart guess? And they're like, well, Dr. A is like, yeah, go ahead. And I'll say this thing, and he'll be like, oof, really close. Or, okay, I know what you're saying, but I think that this concept you have a little bit off. And I'm like, okay, that's so interesting. I hadn't thought about it in the past 4 years, and I had been thinking such and such for many years now. That's incredible. Thank you. Like sometimes I learn so much about the MIC. Everything that guides our antibiotics is whenever you have a micro organism and you have these susceptibilities, you have the minimum inhibitory concentration. And I had never thought about it in the light that Dr. A illuminated me with. So now I understand the MIC much better. And all these little nuances, it's not just comparing the number, how sensitive is this one versus this one. Sometimes it might say an antibiotic is a microbe is completely sensitive to such antibiotic, but you shouldn't even consider it because the antibiotic would not reach that place you're trying to reach, right? So you have to take into account all these things, and the concept that the MIC was made for your bloodstream and not specifically for your lungs, for example, is something that I'm like, for example, when you usually want to get to a MIC of 3 to 4 times the MIC concentration in the bloodstream if you want to effectively kill a bacteria that is in the bloodstream. So I didn't know that. But let's say this bacteria is in the lungs. So then you have to think about the distribution of the blood in the lungs, because it will give you the MIC if the bacteria was in the bloodstream. But the bacteria it's a pneumonia and it's in the lungs. So the analogy Dr. A gave me is like about 1/3 of what is in the bloodstream will be distributed to the lungs. So now guess how this is so interesting. So maybe the MIC that was 3 to 4 times for the bloodstream, if you want to kill it effectively in the lungs, you will have to do 3 to 4 times the MIC. But if you only get 30%, so you have to multiply it more times. So it's going to have to be almost 12 times or 10 to 12 times the MIC. So maybe the concentration for you to get to such a high MIC will surpass the toxicity level. So maybe only that will take this antibiotic out of the picture and not even an option, because if you want to get to an adequate concentration of this to actually get to the lungs, you're surpassing any safe levels of this medication in your organism. That's just one pearl, and that's something that is so interesting. I'm sure that most of you seeing this video have never heard about it. And you did step 1, you did step 2, you have rotated already in the past in infectious disease, but these are the things that if you have a great teacher, you will learn. Because they will ask you, okay, what's your understanding of the MIC? Okay, what do you think this MIC for this antibiotic versus this one means? Which one would you pick? Why would you pick it? For how many days? What is the most common side effect? Oh man, and you're like, whew, I already answered 3 questions in a row. Good. Don't ask me a 4th one. That's what you want. You want to get to that out of the comfort zone. So that's a good rotation. That's what you want to search for. And I can tell you now that if you actively try to get into those difficult, non-toxic rotations and situations, you will grow exponentially. Like 1 year in these types, 1 month worth of one of these rotations would equal 5 months of rotating, seeing the same patient, same population, same amount of everything, but with an attendant who is not devoted into your learning. And of course, you have to put in the effort. That's what I'm saying. It's not showing up, only showing up. Yes, showing up will be part of the equation, but you have to also show them, appreciate the time they've invested in you, appreciate it. That's why when you're in a rotation, the attendant, a good attendant, will be rejoiced when they ask a question 2 weeks down the road that you didn't know at the initial week. 4 weeks after, they might ask, okay, so what do we have to check in this patient on linezolid? So you're like, okay, blood counts. This can be associated with thrombocytopenia. And Dr. A can be like, wow, you remember it. That's good, right? Or could ask, okay, with daptomycin, what is the side effect we worry the most if the patient starts having shortness of breath and desaturation? And you're like, oh yeah, it can produce the pneumonitis and it's associated to the antibiotic and not necessarily a new pneumonia. And he said, wow, okay, good. That's what you want to do. You want to treasure these moments. You want to write it down on a piece of paper. When you get a clinical pearl, you write it down. You see it right here? You don't want to forget it. Here I wrote cryptococcus on x-ray. Infection in the lungs can look like a mass. So what's the clinical pearl here? If you have a patient with previous lung problems, meaning it's a risk factor for crypto and potential immunosuppression associated, but I know that's a plus minus. But if you have those things, you do an x-ray, the patient has constitutional symptoms and a fever, and you see a mass, not necessarily go to a VATS and get a biopsy immediately. You can run a crypto antigen, and if that is positive, you treat the crypto. If the clinical symptoms improve and the imaging improves, you don't have to open the thorax. You don't have to open the chest. And so those are one of many, right? That's something that happened today. That's how you recognize it. I wish you the best of luck in your journey. Tell me about your experiences. And yeah, we can continue speaking. I had to make this video because this is the exception of the rotations anywhere in the world. Most of them, of course, are going to be average in the normal distribution. But when you recognize a good one, be appreciative, give it your all, grow exponentially, and try to, thank these people. Okay, see you in the next one. Leave any comments, feedback, etc. Peace.